So Gero+Pharm Part 3 is really pretty simple, just a couple of slides. It's dealing with some laboratory findings in older adults that are impacted by either medications or some other conditions. But it's important to take a look at laboratory findings and also remember that some age-related changes could impact those findings. So we know that the number of stem cells in the bone marrow is decreased and the speed of red blood cell production is slowed. So exogenous erythropoietin is less effective to stimulate red blood cells. The lymphocytes and cellular immunity decreases. There's an increase in number of immature neutrophils rather than an increase in total lymphocytes in response to infection. That creates a left shift, and the platelet adhesiveness increases. Hemoglobin and hematocrit levels typically stay within the normal range, but they are decreased slightly. When our patient has a electrolyte imbalance, they almost always have symptoms of weakness, fatigue. They could have confusion, but they also could have muscle pain and cramps and bradycardia. If our patient has a low potassium level, that really potentiates the effects of digitoxicity. So if you get a low potassium level in a patient who's on digoxin, you want to check that dig level right away too. In long-term care, labs are only drawn extremely infrequently, but be ready to collect labs if your resident begins to show signs of new or rapid onset confusion, which is oftentimes the first thing that you will notice. So they're very helpful in understanding clinical signs and symptoms, and an abnormal lab should trigger a comprehensive patient assessment, obtaining information about signs and symptoms, patient history, psychosocial and physical exam.